So good evening, welcome to the Heart Zone, thank you for coming to join us. And just by way of explanation, what we're going to be doing is showing you a little bit of what happens when a person like you or I, a normal person with no symptoms, becomes a patient. What happens, where they go, who is involved, and how they end up seeing their GP a month later. So here we have Lily. Here we have Lily in her flat, doing her cleaning, starting to look a little bit unwell. Looking a bit sweaty. Just touching her chest. She seems to be in some pain, getting her phone out and is dialing 999. Just to reassure you, she's not really having a heart attack, so please, if you're all friendly, 999.
Hello. No, I'm so sorry. I don't really feel very well. Yes. It's Lily. Yeah, I'm so sorry. I don't feel very good. Yeah. I've just got this terrible pain. In my chest. I don't easily breathe, and I feel very strange.
She's quite short of breath. She's not able to stand up anymore.
Yes,
She's quite scared and quite panicked.
My address is number 10, Elgin Avenue, and that's West 8. Sorry. I'm sorry. I don't feel well.
Our ambulance crew are coming in.
I got it. Yes.
We're going to start processing.
Hello. Hello, what's your name?
Lily.
Lily, what's the problem?
I've just got this terrible pain.
You've got a pain in your chest?
Yeah.
Okay, try and describe that pain for me.
It's completely. I've just never felt anything like it's just completely sort of crushing me.
Like a crushing pain? Okay. Does that pain move anywhere?
I feel it slightly in my arm. Sorry.
No, that's all right. So the pain's going into your arm. Do you feel short of breath at the moment? Yep. Okay. Lily, do you have any medical history at all? Any medical problems?
There's quite a lot happening all at one time here, so the paramedics are continuing to ask you questions.
Have you ever had a heart attack at all? No. Do you have high blood pressure? Okay, all right. And is there any family history of heart problems?
Yes.
Okay.
Yes. My father died.
Yep.
A heart attack. He's younger than me.
Okay.
And my
Lily.
sister.
Okay. Right, Lily, are you allergic to any medicines at all? Okay, I'm going to give you an aspirin. I just want you to chew this aspirin, okay? All right.
Swing your legs out in front of you so I can put the other dots on your ankle.
Feel very sick.
Okay. Right.
Oh, so sorry.
She will be okay, and they're going to do the right thing and get her to hospital.
Lily, what we're going to do is we're going to do an ECG of your heart to try and work out if that's the cause of this pain, okay? What I want to do is give you a little spray of this medicine called GTN under your tongue to try and relieve that pain in your chest, okay? So I just want you to open your mouth, lift up your tongue. I'm just going to put that in, okay? And I want you to hold very, very still while we do this ECG of your heart, okay?
I'm so sorry.
Right, Lily, have you ever had this pain before?
Not
Okay.
like this. Not
Okay.
like this.
All right. Right, Lily, I've had a look at your ECG. It looks like you're having a heart attack at the moment, okay? So what I want to do is we'll get you out to the ambulance and we're going to take you to a specialist heart attack centre where you can have a procedure called angioplasty. Essentially what's happening is one of the arteries in your heart is blocked and your heart muscle isn't getting enough blood and oxygen, and that's causing this pain, okay? So what we're going to do is going to pop you to the ambulance in our chair and then get you assessed there and then get you to the heart attack centre, okay? All right?
She made a decision
Okay.
that she needs to go to hospital. She can't stay where she is, and she needs more investigation
Right,
and
Lily.
some treatment for the cause of her chest pain.
What you to
Based on
do,
her
stand up, I'm going to sit you in this chair, okay? So bend your knees.
We have enough evidence to say that she needs to go to hospital very quickly.
Okay.
Where she'll be
Pop
seen
yourself
by
in the
a
chair.
cardiologist.
Well done. Well done. Okay, there we go. Right. Arms on your lap. Okay, just sit back for me.
I'm so sorry.
That's okay. Right.
So we'll follow her story on as she goes into the ambulance.
Okay, right.
And if you can't see, feel free to move along the gallery or move along with us along the ground.
You want to pop nearly on the bed? I'll go get the kit.
Yeah. Okay, Lily, take your time. Let's just move over and get you onto the trolley bed.
So they're transferring her onto a trolley in the ambulance. You can see here.
Swing your legs
They've
up.
got various bits of kit with them, a bag full of all sorts of things that they may need to give her. And the thing they're getting ready now is a drip that's going to go in the back of her hand.
Lily,
That means that they can give her some medication through there for the pain.
Sorry.
And also give her some fluids and help her to feel more comfortable.
Lily, what I want to do is pop a little needle in your arm so we can give you some morphine. How bad's that pain in your chest?
Still feels bad.
It's still there, okay. If you had to score the pain out of 10, 0 being no pain and 10 out of 10 being the worst pain you can imagine, how bad's the pain?
It feels about 9.
About a 9, okay. I've given you some morphine to try and help with that pain, alright? And we're going to take you to the hospital now, alright? I'm just going to give the hospital a call.
Some morphine and they're going to take her to hospital.
There's some lights and sirens, a little bit of noise on the way in.
As she's arriving in hospital and as she gets to meet the cardiologists. So she's going to come around on the trolley.
Sorry.
And here she's going to meet the cardiologists who have already heard about her on the phone. They know her story from the paramedics who have called ahead to say that they're coming. And the cardiologist now is going to meet the patient first time.
Hello. Hi, this is Lily. Lily's 59 years old. She's got a 1-hour history of central crushing chest pain radiating to her left arm. Her 12-lead ECG is showing that she is having an inferior myocardial infarction. She's been given aspirin, GTN and 5 milligrams of morphine IV for the pain. She's still She has a past medical history of high blood pressure, no previous heart attacks, but she does have a family history. Her father died of a heart attack and her sister has a cardiac history.
Right, and you have given her aspirin, GTN spray and morphine.
That's correct.
Okay, how was the pain now, Lily?
It's a little bit better, but
Still in pain. Okay, I mean, I have had a look at the ECG. Just a moment. Let me have a listen to your chest first. Okay, chest is fine. There are no heart murmurs. I had a look at the ECG, which shows a heart attack. And heart attack occurs when there is a blockage of the blood vessels of the heart. And what we need to do now is to do a procedure called an angiogram, which will show where the blockages are, so that we can open up the blockage and put a balloon, open it up with a balloon and put a stent in. So that will provide good blood supply to the heart, and that should relieve the pain. Now, there are risks associated with the procedure. The risks are stroke, repeat heart attack, bleeding, or emergency bypass surgery. Okay? Are you happy for us to go ahead with the procedure? The procedure is done under local anesthetic. It can be done either through the wrist or through the groin, and we'll ensure that you are completely pain-free during the procedure. Okay? So if you are happy for us to go ahead with the procedure, you need to sign this form, which is called the consent form, Lily. Okay? Yeah.
I'm just a little scared.
Yes. I mean,
Just here.
we will ensure that you are comfortable throughout the procedure. Okay?
Please.
I'll be there in the lab as well. Okay? Thank you.
And now they'll wheel around into theatre. We'll let them get her ready for theatre. If we move further on this way, so we've got lots of people in here in blues. We've got the sterile people in the middle in their scrubs and their hats. And they're the people that are actually doing the procedure. They're the consultant and registrar cardiologists. We've got our patient up here. I don't know if many of you can see, but she's lying here looking up at the X-ray machine. How are you feeling at the moment, Lily?
A bit scared, but better.
How's that pain doing?
It's easing.
Okay, so she's feeling a bit better. The thing above her is an X-ray machine, and what you'll see on the screen in a moment is when they squirt the dye in, you'll see a series of pictures And every so often you'll see a map of those blood vessels around the heart, and it will show these cardiologists exactly where the blockage is. There's a chap at the end of the bed who's controlling the X-ray machine and taking the pictures, and then we've got some medical students here and a nurse who's helping the cardiologists.
Okay, Lily, we're going to sort you out, okay? I know you're a bit uncomfortable there, but if we can find this blockage and fix it, it'll be fine for you. You'll be feeling much better. Okay, I'm Dr. Malik. I've got Dr. Davies with me today as well. Okay, let's get this sorted out. So let's have some anaesthetic. May feel like scratching your skin down here, only a tiny one. There we go. Let's get this sheath in. Now, yes.
How do you know which artery is causing the blockage?
Well, what we're going to do is look at the ECG, and that's going to tell us it's probably the right coronary artery, so it's a good question. So I'm going to take a picture of the left coronary artery first, get that out of the way. Here we go. Let's have a look on the X-ray screen. Oh, that's good news. That left coronary artery, which looks a nice straight shape, has got no blockages in, so we can move on and take a slightly fatter pipe to get our equipment for the angioplasty in. So let's have a look at the right coronary artery. We'll get this pipe up there for you, Lily. Okay, let's take some pictures of that. So let's have a look at that. Ah, I can see a pinch there. Not fully blocked, but guys, well, do you know why? It's because the drugs we've given already have probably opened up that blockage, but there's still a problem there, and we need to try and fix it. So the best way of doing that is with a balloon and a stent. So let's get a wire down that artery.
What is a stent?
So a stent is a meshwork, good question, a little bit like chicken wire that holds the artery open as a scaffold. So the balloon will make a little passage and the stent will hold the artery open so it doesn't collapse again. So we've got the wire through, and let's get our stent up there. Okay, so the stent is, let's have a quick look at that, a bit more dye. That's in the right position. And so what we're going to do is inflate now. So let's inflate up. So away we go, it's a syringe, and there we go. The balloon's going up there. That's going to put the stent in the right position. And let's deflate. And let's take a picture and see what we see. Oh, that narrowing's gone. Lily, how are you feeling there? A bit better. It's like magic, isn't it? That artery's opened up and this pain's getting better. So let's take all our equipment out now. And our procedure's pretty much finished. Let's seal the hole in the leg that we've made. Brilliant. Okay. So there you go. A little uncomfortable if you take that out. Great, well done, Lily. Your job was to stay nice and still so that we could do the procedure for you, and it's gone really well, so you'll be feeling much better soon. Okay, well done.
Okay, if we could just ask, this is a follow-up visit to have a chat to Lily about how she's feeling and if she's got any questions about her procedure.
Hello, Lily Smith.
Yes.
Hello, please have a seat. My name's Dr. Hing. How can I help?
Oh, I had to come for a follow-up checkup, I suppose, because I think you might know I had a bit of a really bad turn.
Yes.
It was a bit of a shock, actually. I just didn't expect it at all.
Absolutely, absolutely.
Yeah.
How are you feeling?
Oh, I'm so much better. I think I was terrified to start with, really. I think I still am a bit scared about what I can do, about what happened, could it happen again? I've got so many uncertainties, I think, so...
Pick one. What would you like to know?
I suppose I really am quite worried about it happening. I'm really scared every time I walk faster. If I'm on a tube, I'm thinking, what would happen? You know, if I've got to stand, can I walk? Can I? All these things. I know they said, well, just try and be normal, but I don't feel it. I feel really scared, I think.
Well, it's really important to know that a lot of people who have heart attacks recover very well, and looking at your report, things have got much better, which is really good. There are ways to reduce the risk of having another heart attack, and some of that is involved with taking the medications, and I know there's a lot of medications
So
that we
many,
started.
I know.
Absolutely.
Yeah.
But they all help to reduce your chances of having another heart attack. There are also things that you can do to reduce your risks of having another heart attack, and particularly smoking, controlling your diabetes, controlling your blood pressure, and doing some exercise and looking at your diet will all help with that.
No. I really, I must admit, I haven't been smoking so much. I've had maybe one, and I really haven't. I mean, but what a horrible way to make me stop. I was thinking I'd cut it down to about 5 a day, and that would be absolutely fine, but
It's also really important to be aware that after a heart attack, a lot of people can feel quite low, and some people can feel quite depressed. Do you have enough support at the moment?
I do. I mean, I have my daughter around, and sister, and so I do. But thank you, because I think I am. I just need some confidence. I've lost all my confidence just going down the street, or if I feel the slightest twinge, I think something awful's going to happen.
Absolutely. Well, if there's any further worries that you want to discuss, then do let us know, and we'll try and find ways to help deal with that.
Thank you.